Hello, I am Dr. Amith Kamath, consultant orthopedic trauma and robotic joint replacement surgeon from Unique Healthcare Center, Rajajinagar, Bangalore. In the last video, we have discussed about osteoarthritis of the knee joint and what the available treatments are. In this video, we will just go through a gist of what osteoarthritis looks like and how the treatment of total knee replacement is done and how my patients have been recovering post a total knee replacement. Here in front of me, you can see a couple of models wherein this is a normal knee wherein the cartilage or the green area is smooth and the movement occurs smoothly. Over time, due to breakdown of the cartilage, what we call as a degenerative process, what we see happening is a bare area that forms between both the bones. As you can see in the thigh bone as well as in the leg bone, you will have both these areas of raw cartilage rubbing against each other, and that is when the initial pain starts. Now, we've already spoken about the treatment options for the early arthritis that can occur. Now, as this progresses, you have some extra bone formation that occurs on the side, and then you have a further breakdown, and all these reddish areas depict the inflammation and the swelling that can occur in the joint, as well as these are the bare areas that cause a lot of pain. Now, when it reaches this stage wherein the pain is so much that it disturbs their daily living, their sleeping and all of that, what we tend to do is we give them the option of something called a total knee replacement. Now, what you see here in the silver shiny parts are the metal parts and the plastic in between. So we do not take this new knee and jam it in. They are broken down into two parts, which is the thigh bone part, the plastic, as well as the metal part that goes into the leg bone. So there are two metal parts, and what we do is we break the joint, we open it up, and then we shave the bone surfaces wherein this cartilaginous area, which would have turned to a reddish breakdown area, is now made raw bone surface. Now once this raw bone surface is done, what we do is we place the metal into the leg bone, and then we place some metal into the thigh bone, and once both of this is done, we place the plastic. The plastic is placed in the leg bone and we reduce the joint. Once the joint is reduced, you get a smooth movement of the thigh bone over the leg bone, and this creates a complete joint movement, which in turn leads to a pain-free movement from having a painful joint to taking it back to a pain-free joint, which is near similar to the joint that was there at the initial process. Now, let us show you some of my patients who are post knee replacement surgery and their recovery story as well.
ಸರ್ಜರಿಯಾಗಿ ಎಷ್ಟು ದಿನ ಆಯಿತು?
ಇವಾಗ
7ನೇ ತಿಂಗಳ. ಓಕೆ, ಹೇಗಿದೆ ಮಂಡಿ ನೋವು ಇವಾಗ?
ಮುಂಚೆ ಆ ನೋವಿಲ್ಲ ಸರ್.
ಹೇಗಾಗ್ತಾ ಇತ್ತು ನೋವು ಅಂದರೆ? ನಡಿಲಿಕ್ಕೆ
ಸುಸೈಡ್ ಮಾಡ್ಕೊಂಬಿಡೋಣ ಅಂತ
ಯಾಕಂಗೆ ಮಾತಾಡ್ತಾರೆ?
ಅಷ್ಟು ಆ ನೋವು ತಿಂತಾ ಇದ್ದೆ. ನೈಟಲ್ಲಿ ಎದ್ಬಿಟ್ಟು ಟಾಯ್ಲೆಟ್ಗೆ ಹೋಗ್ಬೇಕಂದ್ರೆ ಒಂದು ಸ್ವಲ್ಪ ಎದ್ದು ಕುತ್ಕೊಂಡು ಕಾಲು ಸರಿ ಮಾಡಿಕೊಂಡು ಎಷ್ಟು ಅರ್ಜೆಂಟು ಅಂದ್ರೂ ಹೋಗೋಕ್ಕಾಗ್ತಿರ್ಲಿಲ್ಲ, ಅಷ್ಟು ತೊಂದರೆ ಆಗ್ತದೆ.
ಓಕೆ ಓಕೆ,
ತುಂಬ ನೋವು ತಿಂದ್ಬಿಟ್ಟೆ ಸರ್.
ಓಕೆ, ಈಗ ಆಪ್ರೇಷನ್ ಮಾಡಿದ್ಮೇಲೆ ಚೆನ್ನಾಗಿದೆ?
ಆರಾಮಾಗಿದೆ ಸರ್.
ಓಕೆ ಓಕೆ, ಮಂಡಿ ಮಡಿಸ್ಬೋದಾ? ಚಕ್ಲುಬಟ್ಟು ಹಾಕೊಂತೀರಾ ನೀವು? ಹಾಕ್ಕೊಡಿನ. ಓಹ್, ಓಕೆ ಅಮ್ಮ, ಓಕೆ. ಒಟ್ಟು ಆರಾಮಾಗಿ ನಡೆದಾಡ್ತೀರಾ, ಏನು ಸಮಸ್ಯೆ ಇಲ್ಲ? ಈಗ ನೋವೇನಿಲ್ಲ?
ಆ ನೋವಿಲ್ಲ ಸರ್,
ಇಲ್ಲ.
ನರಕದಿಂದ ಆಚೆ ಬಂದಂಗೆ ಆಯ್ತು.
ಅಮಿತ್ ಸರ್ ಹೇಗೆ ಟ್ರೀಟ್ ಮಾಡಿದ್ರು?
ತುಂಬ ಚೆನ್ನಾಗಿ ಮಾಡಿದ್ರು ಸರ್. ಚೆನ್ನಾಗಿ ಮಾಡಿದ್ರು.
ಅವ್ರ ಬಗ್ಗೆ ಏನಾದರೂ ಹೇಳ್ಬೋದಾ?
ತುಂಬ ಖುಷಿ ಆಗುತ್ತೆ ನನಗೆ, ಅವ್ರ ಬಗ್ಗೆ ಎಷ್ಟು ಹೋಗ್ಲಿದ್ರು ಸಾಕು.
ಓಕೆ ಅಮ್ಮ, ಸರಿ. ಕೂಡ ಏನಿಲ್ಲಲ್ಲ?
ಇಲ್ಲ ಸರ್, ಎಲ್ಲ ಒಟ್ಟು ಹೋಗ್ತಾ ಇದೆ.
ಓಕೆ ಓಕೆ.
ಮುಂಚೆ ಹಿಂಗೆ ಈ ಥರ ನಡೀತಾ ಇದ್ದೆ, ಬಗ್ಬಿಟ್ಟಿದ್ದೆ ಪೂರ್ತಿ. ಎಲ್ಲಿ ಹೋಗ್ಬೇಕು ಅಂದ್ರೂ ಇಷ್ಟು ಮಾಡ್ಕೊಂಡು ಹೋಗ್ತಾ ಇದ್ದೆ. ಈಗ ಆ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಸದ್ಯಕ್ಕೆ, ಇದೇ ಥರ ಮಾಡಿದ್ರು.